Welcome to Age Fit MD with Dr. Zars, a no-nonsense age with power podcast.
Welcome to the Age Fit MD podcast. I'm your host, Dr. Z. And if you want to know what the best way to lose weight is quickly, it's called intermittent fasting. And I'm going to tell you all the secrets of how you can be successful with this really powerful tool. Let's get started. So one of the first things I need to educate you on is, why is intermittent fasting so powerful? Why is it what I recommend? Why is it something that I recommend to all my patients? And how does this set of strategies differ from regular calorie restriction? So let's just take a step back and cover a couple concepts. The first thing I want to address is, my patients will often say to me, "Doc, if I can just work out harder, I can lose this weight." And while it's true, if you want to exercise hard, you can lose weight, it's also very, very challenging to do that. And the reason is, if you're going to burn fat, you got to burn glucose first before your body goes to fat. That means you have to go through all your food that you ate during the day, all the energy reserves, and then you start burning fat. As opposed to, if you calorie restrict, then you're going to find yourself in a place where you can burn fat sooner and easier. So calorie restriction is a much more efficient way to lose weight than exercise, which might sound counterintuitive. So let me dive a little deeper into the physiology behind this. So for thousands of years, we ate a meal and then typically didn't eat another meal for a fairly long time. We were foraging, hunting, gathering, etc. We might not see another meal for up to 2 days. And what's happening there on a physiologic level is, when we eat, we get a spike in insulin. And insulin is our growth hormone. So is a not growth hormone, but it stimulates growth. So insulin causes your cells to take up glucose, to take up fat, to repair what needs to be repaired, and then store that energy as much as it can so that you can use it on a rainy day. Then when you don't eat, your insulin drops, and a hormone called glucagon rises up. And when glucagon rises up, it starts to go into the reserves to burn your reserve fuel. Now, the first source of reserve fuel is going to be the glycogen or the glucose stored in your muscles. The next one is going to be the glycogen in your liver. And then once that's burned up, now you start mobilizing fatty acids and burning fat. So the reason intermittent fasting is so valuable is, basically, here's the structure of how it works. You set a time frame in the morning and the afternoon that you only allow yourself to eat. So to start, let's say that time frame is from noon to 6. Well, it's hard to do that straight out of the gates, because normally we're eating multiple meals throughout the day. We have a constant insulin secretion. Our body isn't used to switching from insulin to glucagon. So when we don't get food, people tend to say, "Oh, my blood sugar is low and I feel lightheaded, I can't take this." Well, what intermittent fasting does is, you train your body to switch between insulin and glucagon more efficiently. So the way you would get started is, on day one, you might not eat breakfast till, say, 9 a.m. Best thing to do is drink ice water and hydrate. After 9 a.m., you want to stop eating around 6 o'clock. A day or two later, you want to push that to 10 a.m. After a couple days, you push it to 11 a.m., and then you train your body to where you're not eating anything at all besides ice water from noon to 6. So what that does is, when you eat your last meal and you go to bed, your body burns through the glycogen in your liver, it burns through the glucose in your muscles, it burns through the calories that you ate. So when you get up in the morning, from whatever time you rise till noon, now you're able to mobilize those fatty acids. And because you've done it in a stepwise progression, your body is used to it. So you lose that sensation of having intense hunger, and it becomes very easy to skip a meal and to calorie restrict. Once you get yourself into that zone and you start adding exercise and you start adding supplements and you start adding really nutritious foods and supplements in the window that you're eating in, the weight just comes flying off. And it's the most effective method I've ever seen amongst all my patients. Every time I see a patient come in and they've lost a huge amount of weight, the first thing I say is, "What have you been doing?" And they say, "Oh, I've been doing that intermittent fasting." Can't believe how easy it is. I'm not even really working out. I'm just restricting the calories that I take in. So that's the essence of intermittent fasting. Start slow, work your way up to noon to 6, and drink a ton of ice water while you're going through it. Now, it may be more difficult for you. You may not get there in maybe a week. Maybe you stick at 9 o'clock for a number of weeks and then go to 10. Either way, that's okay. I've also been asked, well, what's the best window? Is it 10 to 4? Is it noon to 6? What is it? Whatever window will lead to your highest level of success is the window you should pick. That depends on your job, depends on your lifestyle, whatever. But just try to make it so that you only eat in that window, and then you're not eating outside of that, to train your body to flip between insulin and glucagon, and you're going to find that you're going to get tremendous results. You're going to lose weight faster than you thought you could have. And then once you start feeling better, now you start layering in maybe a little more exercise. Then you layer in resistance training. And all these things now multiply, and you're going to get awesome results. It's the best. I think everybody should intermittent fast at least 2 to 3 days a week. The other benefit is it increases your insulin sensitivity. Type 2 diabetes is a disease where the body becomes numb to insulin. It sees so much insulin that it just stops reacting, doesn't take up the glucose, allows your blood sugar to elevate. Intermittent fasting allows your body to get rid of its insulin and have a glucagon spike, where when you're eating all the time, you don't get that. So a great benefit is increased insulin sensitivity, less chance for type 2 diabetes. So there you go. That's the most powerful weight loss tool out there, intermittent fasting. It's relatively easy to do. Consistency is the key, and I strongly encourage you to give it a try. So keep listening to our podcast and come to our website. We're going to keep trying to educate you and empower you so that you can make the best healthcare decisions for yourself and guarantee that you're going to age fit.
For more information about Age Fit MD, Immune X2, or Dr. Z's training, please visit drzars.com for a full line of supplements and educational tools to help you age with power.